Hello everyone, I am Dr. Rahul Dubbaka, consultant gastroenterologist and hepatologist, Care Hospitals, Banjara Hills. Today we will be talking about pancreatitis. In pancreatitis, there are two types. One is acute pancreatitis, then the other is a chronic pancreatitis. The acute pancreatitis, the patient presents with sudden severe abdominal pain. Sometimes it may be associated with vomitings or high fever. The pain will generally radiate to the back, and also eating food will worsen the pain. So this is the normal presentation of acute pancreatitis. Then coming to the causes of acute pancreatitis, the most common cause of acute pancreatitis is gallbladder stones. When there are small gallbladder stones, sometimes they may slip and block the pancreatic duct. So this can lead to the swelling of the pancreatic gland, which leads to severe pain and the other symptoms. Then the other common cause is excess alcohol intake. This is also a leading cause of acute pancreatitis, and also smoking is also a very important cause of acute pancreatitis. Apart from this, the other causes of pancreatitis can be excess triglyceride levels in the body. If the triglyceride level is more than 700 or 800, then the patient is prone to acute pancreatitis. And apart from this, some genetic factors also can lead to acute pancreatitis. If the patient presents with acute pancreatitis, initially, because eating food will worsen the pain, the patient will be kept nil by mouth, and the supportive medications will be given to reduce the inflammation of the pancreatic gland. And also, because the pain will be very severe, painkillers will be given to manage the patient. And also, because there is a lot of fluid loss from the body, IV fluids will be given to the patient. So if the patient presents with mild acute pancreatitis, generally within 2 to 3 days, the patient will have a good relief from the symptoms and also can be discharged. Whereas if the patient is present with severe pancreatitis, sometimes the treatment may last for more than a week or 10 days, or sometimes the patient may land into complications such as renal failure, sometimes hepatic failure, and also worsening of the lung function, and sometimes the blood pressure may lower. So if the patient has complications, sometimes even ventilatory support may be required for these kind of patients. So patients, if they present with acute pancreatitis for the first time, they should take adequate care so that there may be no recurrences. Especially if the patient has a habit of smoking or alcohol, they have to be stopped, and the patient should never ever take alcohol or continue smoking. Even occasional intake of alcohol or occasional smoking may also can lead to recurrence of the acute pancreatitis. Sometimes acute pancreatitis, the patient may land up into chronic pancreatitis, where the patient will develop small stones in the pancreatic gland, and also the pancreatic duct may be deranged in these patients. These patients are more prone to diabetes, and also a condition called as steatorrhea, where the fat which is consumed in the food will not be digested adequately by the pancreas and can lead to loose stools or foul smelling stools, which can also lead to significant weight loss. And also, because there is fat malabsorption, the patient may also present with vitamin deficiencies such as vitamin A deficiency, vitamin E deficiency, and also vitamin D and vitamin K deficiencies. So these patients, sometimes they may lose more than 20% of the body weight also, and the diabetes sometimes may be very difficult to manage. So these kind of patients, if presented early, they will be managed with pancreatic enzyme supplements and also painkillers. And in some chronic cases where the patient is not responding to medications, surgical interventions may also help these kind of patients. Thank you.